Okay, so I can see some people are starting to join. Welcome, everybody. Just checking that you can see my screen okay, guys? The slides. Welcome, everyone. Great to have you joining us for this workplace panel. I hope you've grabbed your lunch or a cuppa. Welcome. So feel free to pop in the chat where you're joining us from. It'd be great to hear from you. We'll just take a moment or two while a few more people join, and then we'll get started and I can introduce you to our lovely panel today. You'll note that we're recording this so that you will have the opportunity to watch it again later on, or to share it with any of your colleagues who can't make it today. Okay, the chat's disabled, so thank you. Thank you for that. It doesn't seem like you're going to be able to communicate to us from the chat. Yes, the functionality of Zoom changes, doesn't it? And it can make it a little bit tricky. I might turn off my little chat box then, given we're not going to be able to hear from you today. So I'm going to get started, and welcome and thank you so much for joining us for this webinar series, Expert Insights for Workplace. My name is Chris Kafer and I'll be your moderator for today. I'm a clinical psychologist and I work in private practice, but I also work for the Black Dog Institute as part of the service implementation team, where I help develop and facilitate programs for workplaces, health professionals and research. In my private practice, I work with lots of people for whom work plays a really huge role in terms of their mental health and well-being and in terms of their recovery. Today, we're going to be talking about managing psychosocial risk factors at work. As we get started, I'd like to acknowledge the Aboriginal and Torres Strait Islander peoples as the first inhabitants of this nation, and the Awabakal people and the Gadigal people of the Eora Nation as the traditional custodians of the land on which we meet and work. And for me, I'm joining you from Awabakal lands, joining you from Newcastle. I recognise the continuing connection to land, water and community, and pay respects to all Aboriginal and Torres Strait Islanders elders past, present and emerging from all the nations across this country. So let me introduce you to our panel today. With us, we have Dr. Aimee Gayed, who's a registered psychologist and postdoctoral research fellow with the Workplace Mental Health Research team at the Black Dog Institute. Her research focuses on investigating the benefits of evidence-based workplace interventions designed to promote more mentally healthy workplaces. That's a bit of a mouthful. Aimee, welcome. And welcome also to Ian Firth, who's currently the State Inspector for the Psychological Health and Safety team at Safework, New South Wales. Ian's role involves contributing to strategy, policy and guidance around psychological health at a state and national level, providing advice to industry and responding to complex matters and investigations. Welcome, Ian. And we have Christine Turner, who's the Executive Manager of Corporate Services at South Western Sydney Primary Health Network. And the network is an organisation passionate about quality healthcare across the community, but also passionate about supporting their workforce of 80 employees. Welcome, everybody. We have some questions for the panel that we hope will reflect the essential things you need to know about this topic, but we'll also be allocating time for questions at the end, which I think you'll need to be popping in the Q&A box. So we might start with you, Aimee, to set the scene a little bit. If you can define for us what we mean when we're talking about psychosocial risk.
Yeah, thanks, Chris. So psychosocial risk factors are conditions that are present within the work environment that impact on the mental health and the well-being of employees. Some people might also use the term psychosocial risk hazards or work-related mental health risk factors, but these are all really referring to the same thing, which is essentially the primary sources of work-related stress that for some people may influence the development and the maintenance of their mental ill health. You can see this diagram here on Chris's slide. Through our research conducted at the Black Dog Institute, we've identified a number of these psychosocial risk factors or work-related mental health risk factors, and they can be divided into these three categories that you can see in the diagram. So organisational factors, team factors, and individual job level factors. So at a broader level across the workplace, we see organisational factors such as things like how much a workplace values the mental health of their staff. So that's what we call the psychological safety climate. Or there's the level of stigma and the general attitude towards mental illness present within a workplace. So we know stigma has can substantially impact on people, and it may affect how others view one's capability at work, or make it difficult for workers to ask for help when needed. And it creates a barrier for early help seeking or recovery after illness. That's an organisational level risk factor. If we move across to the team level factors, we're talking about workplace relationships. So how much support one receives from their colleagues or their supervisors. Is bullying present in the team? How is that managed? And then finally, up the top there are the individual job level factors, and they're ones that are specific to the individual role, such as the demands that are placed on an individual and the level of control they have over the duties that they carry out in their role. We know when demands are high and control is low, that this can lead to high levels of job strain, which places workers at increased risk of mental health problems. So these are just some of the many psychosocial risk factors present across the organisational, the team, and the job individual job levels within the workplace.
And I imagine there's interactivity between those factors and a kind of a clustering that will sometimes occur in workplaces, yeah?
Yeah, absolutely. And not all of them are present in all workforces either. So for example, we've got at the individual job level, there's the exposure to trauma, and so that's sort of probably more relevant for first responders and those in high risk industries.
Yeah, great. All right, thank you, Aimee. That's a really very thorough overview. Ian, in your role as inspector, what are some of the common psychosocial risk factors that you come across?
Thanks, Chris. Yeah, we come across sort of quite a variety of psychosocial hazards as inspectors, and we find them in the way that work is done, the way that it's organised, the way that it's managed, but we also find it in the environment that the teams are working in. So even in hazardous work environments that can contribute to that mix of psychosocial hazards. But probably, really importantly, it's the way that it's managed, and it's the way that we interact, our working relationships and our behaviour in the workplace that is also a really major part of psychosocial hazards. So some of the most common ones that we see in the regulator are around that workplace behaviour, because that's really the most visible, and those sorts of harmful workplace behaviours, I guess the most well-known way of thinking about them are in terms of bullying, harassment, client-related violence. So the most common ones that we're seeing are generally around that workplace behaviour. Obviously, COVID's changed things a bit, like it has for everything, not only work health and safety, but we're really starting to see more people talking to us around workload, those high work demands. Certainly exposure to violence and aggression has been coming through loud and clear throughout COVID and kind of post-COVID. And we've noticed some challenges from workplaces around providing, adequate support, particularly manager support. How do you do that in a virtual world? I guess it's something that a lot of workplaces are asking themselves. So yeah, they're some of the more common ones that we've been seeing.
Yeah, excellent. And this whole new phase too around the hybrid workspace. Yeah, interesting times. Thanks, Ian. And Christine, how did you become aware of the psychosocial risk factors relevant to your organisation?
So back in 2019, we had a realization in our organisation that our work health and safety risk management approach didn't identify any risks related to mental health. And despite the fact that majority of our claims and our workplace challenges were actually related to mental health concerns.
Yeah. And so you realised you had some work to do there.
Yeah, most definitely.
Yeah. And what did you discover are the main ones that were facing your workforce?
Sure. So at Southwestern Sydney PHN, the more common risk factors for our organisation are around heavy workloads and added stress, that additional burden there. We also had a realization that we had a lot of new managers and new people leaders in the organisation, and not necessarily having the adequate skills and training in place to commence in those roles. As we've mentioned, remote working is a risk factor there. And finally, for us, a big one is organisational change. So we're constantly faced with frequent changes across the business and across the sector, which occurs quite rapidly.
Yeah, absolutely. And I was just thinking about with the remote working too, and particularly during lockdown, there was always the opportunity just to do more work and harder to put boundaries around it. So if managing workload is an issue, you put more into it, it becomes, more of an issue. Yeah. All right. Thanks, Christine. And Ian, why do organisations need to be on the front foot with this?
Yeah, Chris, there's a lot to the why. And I think one thing that COVID has sort of really done for us is to engage workplaces in that question. And so we spend a lot of our time at work, even more so, as you just mentioned, some of those clear geographical boundaries aren't so clear, anymore. So we spend a lot of time at work. And when we think about why, it's important for an organisation to identify and then manage these psych hazards. So just putting my work health and safety hat on there and referring to them as hazards, sorry, but it's the same thing as risk factors. So one of the key reasons is it's about prevention. Workplaces have been telling us at the regulator and been showing us examples of what they've been trying to do to address psychological health within the workplace over the last few years. And what we're seeing is a lot of initiatives in the recovery space, a lot of programs, return to work programs, a lot of education around how to manage psychological injury. So one of the reasons it's important to identify and then manage the risk of psych hazards is to try and get in the prevention space, start to try and manage some of these controllable work factors before it escalates. What we surveyed when we, here in New South Wales, when we developed the Mentally Healthy Workplaces strategy, we surveyed a number of businesses, and what we found was that around 80% of them told us, self-reported to us, that they had what they felt was an ad hoc approach to the management of psych hazards. So we're really seeing a clear indication that businesses need to put a little bit more thought into this, and I guess start to allocate some of their resources. But along with that, prevention argument, it's just good for business. Good work is good for us. And we've been seeing a kind of an alarming trend in psychological injury claims, which are only one small piece of the puzzle when it comes to measuring the impact around mental health within the workplace. But we've been seeing, a really concerning increase of around 53% in the number of psychological injury claims, and that figure was between 2014 to 2019. We saw an increase of around 53% in psych injury claims here in New South Wales. That was compared to a 3.5% increase in physical claims. We also know that there's some hidden costs. There's absenteeism and presenteeism costs, there's staff turnover costs, there's cultural costs, and then there's the cost that the worker takes home to their family and their community when they're not well. something that we're really discussing, more and more these days is there's a cost to physical health within the workplace as well. So some of these psychosocial hazards or psychosocial risk factors have actually been associated with physical illness and long-term poor health outcomes, certain types of cancer, heart disease.
Yeah, a very compelling argument as to why organisations need to be addressing it. And within organisations, who's responsible to manage these workplace risk factors?
So there's a few different roles within the organisation that have duties to manage these. I guess, one of the main arguments for taking action in this space is that it is the law. You do have a legal obligation to manage risk to workers' health and safety. So when we go through the work health and safety legislation, there are a couple of key sections of the Act that really highlight some of the main duties around managing the risk of psych hazards. Probably the most important one is that business's primary duty, or for those of you in your audience who are not in under the harmonised work health and safety scheme, you will have something similar within your own work health and safety or OHS legislation. But there is this main primary duty. So that's where the business or the person undertaking the business has a duty to ensure that psych hazards are effectively managed by first trying to eliminate them. And if that's not reasonably practicable, which it often isn't when it comes to psych hazards, then they need to minimise so far as reasonably practicable. Some of the other main duties are the officer's duties. So where there are, really senior decision makers within an organisation, they can sometimes have officers' duties, otherwise known as due diligence duties. And this is where, some of those senior decision makers need to actively seek out relevant knowledge and understanding. They need to make sure that they're relying on good information, that they're verifying what's being provided to them by lower levels of management. Then there's the worker duties, and workers have a duty to take care of their own safety and to follow reasonable health and safety procedures. But stepping aside from that kind of legal duty, it's also really important for workers to know how to report this stuff, within a workplace, to know where to do it, who to do it to. And the other really important duty, just to wrap up, is the consultation duty. So major part of the Act and the regulations, and it's really super important in the space around psych hazards, because you need to understand your workers' perspective before you can take action.
Yes.
Thanks,
So
Chris.
it sounds like it's sort of a shared responsibility, importance of communication, importance of people knowing, what their responsibilities are and getting that expert help to position themselves appropriately. Yeah. Yeah,
definitely. And what's a little unique here in the consultation space, I think, is that the mechanism of injury, or how these work factors cause harm, is actually through the individual's experience. So that makes talking to your workers and understanding where they're coming from really important. Things like manager competency in this area can be crucial here. Might not be specified in the legislation to that degree, but being able to have a conversation with your team, what's happening here at work, how's it affecting you, what can we do about it, is really important. Yeah,
absolutely. I was thinking, Christine was saying that part of it was that they had a whole lot of new managers, so managers knowing how to do this sounds very important too.
Very.
Yeah. Great, thank you. And Aimee, from your research, what's key for organisations to consider when addressing this?
Yeah, so I think there are two key things for organisations to consider when looking to manage psychosocial risk factors. So firstly, I think understanding that most of these factors can in some way be modified to minimise risk and to create these more mentally healthy workplaces. And then secondly, that we're looking at evidence-based interventions that are tailored to the organisation are the most effective avenue to do so, both when responding to workers who are already unwell, but also importantly, as Ian highlighted earlier, is in that preventative space, so preventing the impact of these risk factors to begin with. So across the individual, the team and the organisational levels that I mentioned earlier within a workplace, our research has shown that there are really 5 key strategies that can be implemented to address and minimise the impact of these psychosocial risk factors. So starting with primary prevention, so for all workers, regardless of where they, whether they're experiencing mental illness or not, it's important to make the necessary changes to job design and to promote protective factors through these positive work cultures. I guess as an individual starts to develop symptoms of mental ill health or is at particular risk, then we look at responsive strategies such as these individual resilience interventions. So programs that have got the evidence behind them that shows can really build skills for the individual to manage symptoms and risks, as well as workplaces promoting and supporting help seeking, and also facilitating recovery and return to work for their employees. And then finally, I guess it's important for organisations to build resilience for themselves, so organisational resilience. And this can be done by training managers and by promoting mental health awareness and stigma reduction across organisations. So in summary to that, there's the 5 key workplace strategies that we promote. So that's designing work to minimise harm, enhancing personal resilience, promoting early help seeking, supporting recovery and return to work, and building organisational resilience. And what we, I guess, emphasise is the key role that managers play in all 5 of these strategies. So managers do have this really unique role in an organisation where they can make decisions and implement changes within their team that can impact on the psychosocial risk factors for their staff. And we know when managers do this well, and when employees feel supported by their managers, that there are better outcomes for staff. And we see better individual health, including mental health outcomes and productivity. We see a reduction in absenteeism rates amongst staff that are well supported by their managers. And across the organisation, we see morale and performance really boosted. But what we also hear is that managers often feel really uncertain on how to best support employee mental health and how they should manage these psychosocial risk factors within their teams. So through our research, we've investigated the benefits of evidence-based mental health training for managers and how to best support their staff. And what we found are really positive results for programs that go beyond just psychoeducation. So ones that really provide an opportunity for managers to develop skills and how to manage the psychosocial risk factors within their teams. So these programs promote how managers can initiate conversations with staff about their mental health, but also the importance of maintaining regular contact with all staff as a way to build rapport in the first place and make these conversations easier when they need to happen. These programs also look at how managers can provide practical help for staff to access service and resources, and really, I guess, emphasising the point that managers don't have to be, or their role is not to be a psychotherapist, but to be providing that practical support. And also upskilling managers in how to make modifications to other psychosocial risk factors to prevent, in the first instance, the potential negative impact certain aspects of work can have on mental health. So for organisations looking to manage psychosocial risk factors, I'd say they really should consider providing skills-based manager training that increases the manager's application of these evidence-based recommended strategies that can minimise harm in the workplace and support the mental health needs of their staff.
And it's fantastic that that through the research we know what works now. That you know, we've always known that this was an area that needed intervention, but until that research has been done, we weren't really sure what did work. Yeah,
exactly. Yeah.
All right, thank you. So it'd be great to hear, Christine, from you about how this aligns with how you addressed those risk factors that you identified in the workplace.
Sure. So when we identified these gaps back in 2019 in our organisation, we progressed into developing a formal health and wellbeing strategy in the organisation. We created a working group of people who were passionate about health and wellness and representative of people right across the organisation. We also had representation from 2 of our executive team in that particular working group. The objectives of the strategy and the objectives of the working group had a strong mental health psychosocial focus. So we had 4 objectives, 3 of which were mental health related. So those objectives were a general one to promote health and wellbeing for our staff. The second one was about improving understanding of mental health. Thirdly, supporting employees living with mental health conditions. And the fourth one was around addressing risks related to poor health and wellbeing. So an example of that is new mothers returning to the workplace after extended parental leave out of the workforce. That working group went on and they looked to devise strategies. All of this was done in consultation with our staff and looked to put in place some really specific strategies in the organisation. So some of the things that we did do, we invested in our people leaders and our managers, and we provided training and development for those people leaders, including mental health training. We also created a robust plan change policy. So our approaches to change management in the organisation have become quite solid. We have policies, we have templates, and we have evidence-based approaches to effective change management. We've rewritten over 13 policies through a mental health lens. So just looking at them through that different lens and adjusting them to support those psychosocial risks and hazards in a workplace. Our EAP, Employee Assistance Program, is promoted extensively across Southwestern Sydney PHN to our staff and extended to their immediate family members. We also have many avenues for employee feedback and staff input and opportunities for them to have a say in the way things are done in the organisation. And one of the big things which we've been really cognizant of is that our communication is open and transparent as well.
Yeah, wow. And so very collaborative, a lot of getting input from everybody. Sounds like, everyone owning it and that it has continued to evolve over time.
Yeah, most definitely. Yes.
Yeah. And so what has been, the results of addressing this so proactively? What changes have you seen?
So we're really proud of the work that's been done in our organisation. One of the biggest things that we've noticed is a real cultural shift in the way people think and the way people in the organisation make decisions. There's a real focus on our employees' health and wellness. We've had no workers' compensation cases in our organisation since that time as well. We do an annual culture and engagement survey. So we've seen over the last 12 months some really great results there. So around clear communication. So we've gone from 75% of our staff agreeing to that up to 97% of our staff agreeing that we provide clear communication. In addition to that, 92% of our staff feel that we support them to look after themselves, which is great to see. And we have quite a high utilisation of our EAP across the organisation, our employees and their family members. And one of the biggest indicators that we've seen, which has already been mentioned from Aimee and Ian, is our personal leave rates have significantly dropped by nearly 50%. So prior to the strategy in 2019, we were seeing an average of 9 personal leave days per employee. And over the last 3 years, we've managed to maintain that around 5 leave days per employee. So some quite big, significant differences.
Yeah, really significant differences, and measuring that from a number of different angles. Yeah, fantastic. Yeah, thank you. And I'm just going to hear from each panel member around what advice you'd give to organisations. I might start with you, Ian. Oh, sorry, Aimee. I'll go to Ian first, if that's all right.
Yeah.
Yeah, I think, look, there's so much, but I think if I could just give some advice for small business people, I think I'd like to echo what Aimee said around not needing to be a therapist. From an inspector's perspective, we're really interested in the process that you follow, what sort of systems you have. Obviously, you don't have to be documented in a small business. So I'd really echo what Aimee said, that you don't have to be a therapist. You don't have to get it right all the time, but we really want you to have some sort of framework or some sort of process. So for bigger business, the advice would be if you're in New South Wales in particular, check out our code of practice on managing psychosocial hazards at work. And if you're in a different state, you will have a code or your own guidance material that relates to this. But the message for big business is start to think about how your human resource work health and safety and workers' compensation teams can be integrated. It's pretty kind of clear in the code of practice. You need to be across different sources of data to effectively identify and then respond to psych hazards. So, you know, these will come to your attention through workers' comp claims, grievances, complaints, WHS hazard notifications, sick leave trends, staff turnover trends. So there's a whole range of different types of data that can tip you off. So you need to be across all of those different streams. Yeah.
Yeah, and the data tips you off, but then also helps you to measure, you know, progress. Measure the areas that have responded, the areas that might need a different sort of approach. Definitely,
yeah. And Christine's case is a classic example of that, isn't it? And I think, you know, what the code of practice is saying is you can use that data as a bit of a heads up, but then you take that to the affected teams or, you know, work groups and have a conversation with them about it and try and understand what it is about their job. Because they will know, you won't know what they're going through, you know, they will know their experience of the psych hazard. So you really have to take that information back to them and say, what's going on here? Yeah, great. And I think that sort of links in with one of the questions that have come up was about the role of lived experience, expertise informing the approaches to support all staff. So by going back and talking with people about what their experiences are really helps them to be heard and for you to understand what the risks are, but then also to develop a response that's going to be most helpful. Yeah, and they're often the experts in their own job. You know, it's really hard if you're sitting in the head office somewhere to understand, you know, what a frontline worker in Broken Hill could be going through. So when it comes to the actions or, you know, how to manage, they can often give you some advice on what they think needs to be done. Yeah, absolutely. Great. Thank you, Ian. And Aimee, what advice would you give to organisations?
Yeah, I'd say from a research perspective, we recommend a holistic approach encompassing the individual, the team and the organisational level interventions to, I guess, adequately and comprehensively address psychosocial risk hazards. But also really importantly that not one size fits all when it comes to implementing interventions. That programs really need to be evidence-based, so you have the research backing behind it that has shown that this program has been effective, and really tailor the content to the organisation in order to achieve the maximum benefit. And I think that question that you just highlighted, Chris, was really relevant here. With our programs that we develop and evaluate in workplaces, we have an advisory group, and that often is made up of people from the organisation, some of who have lived experience, so they can comment on the relevance of the content. And I think that's a really key feature for the effectiveness of the program for that workplace, and something for other workplaces to take on board when they implement programs. Yeah, great. Really, really tailoring it to the needs. And also, I imagine just checking in after you have run some training to see what worked, what didn't work. Exactly. Yeah. Great. Thank you. And Christine, with all the work that you've done in your workplace, what advice would you give to people?
Sure. So there'd be three things I think that have been key for our organisation that I would recommend to other organisations. Executive leadership and buy-in, people who can make decisions, and also people who are influential in the organisation. So that's important at that level. Secondly, identifying your champions in the organisation. There are many people in your workplace who will have a passion for health, wellness and psychosocial health and wellness, and it's working out who those people are and who would be willing to drive initiatives in that space. And thirdly, which has been mentioned throughout the whole webinar today, is that staff consultation and engagement, talking to your people, understanding what's going on with them and what's important to them, that you can build into some of the initiatives in the organisation and the plans. And what next for your organisation? What does this look like as you continue? Sure. So we've continued. It's business as usual for us now. We have a quarterly health and wellbeing committee that meets, and they continue annually to replan and reprioritise different strategies in the organisation. And that membership shifts as we have new staff coming in. We be inclusive of those new staff as well who want to get involved.
Yeah, fantastic. Thank you. That's very inspiring.
Thank you.
So just looking through some of the questions that we have a bit of time now to consider. Louise asked, what are our thoughts on mental health days? It seems that many organisations are offering 2 additional days per year and called doona days or pajama days. Is this a positive benefit for staff, or is it a reactive approach that fails to address the risk factors? Who would like to answer that one?
I'll jump in and say I don't know. I don't know that it's a preventative initiative, but I still think it's an important piece of the puzzle. You know, when we're talking about everything that a workplace can be doing around creating a mentally healthy workplace, there's a number of different phases. Or, you know, there's the prevention phase, the early intervention phase, the recovery phase, and the promotion of good mental health. Aimee talked a lot about it earlier, so I don't think it's necessarily, you know, something that should be excluded, but I think it's important to understand, you know, where it fits. Often what I hear from workplaces is that it's these are really important options for workers in that early intervention kind of space. Can be great part of, you know, trying to implement a supportive culture and a non-judgmental kind of approach, and really recognises the mental health continuum. We can shift up and down that continuum from, you know, struggling to thriving, even during the day, let alone from day to day. So, yeah. Yeah,
great. Thank you. Aimee, did you want to add anything there?
Yeah, I was just going to add that I guess from the research side, it would be one part of a broader package that's being implemented, and that on its own is probably it's definitely not enough, but it is nice for employees to feel supported in that way, as long as it's included as part of a broader package.
Yeah. Christine,
and I could just add to that how we manage that aspect in our organisation. As an example, we encourage people to use their personal leave for that purpose. So we encourage those open conversations around mental health and encourage people to be using their personal leave in that way if that's what they need to.
Yeah, definitely. Great, thank you. Oh, sorry, I was slightly distracted then looking at the other questions coming up. This one's for you, Ian. Lisa's heard that there are new psychological regulations due nationally. Is that correct? And is there a time frame around that?
I think the time frame will be up to each individual jurisdiction. That's my understanding, and I'm not a policy expert, so I just want to make that disclaimer. So in Victoria, who are not a part of the harmonised legislation, if you're in Victoria and you want to understand more around their progression to the regulation space, you would need to reach out to them. But I understand they've just recently closed consultation, public comment on their proposed regulations. For the rest of the harmonised scheme, yes, Safework Australia have updated the regulations, the model regs, and I believe they've published on their website. And it will now be up to each jurisdiction. On the Safework Australia website, there is a little comment there just to clarify for you that it doesn't mean that it is law. It is now up to each jurisdiction whether they adopt it in part or whole. In terms of timeline, again, it probably depends on each of the jurisdictions. Yeah.
Great, thank you. Aimee, here's one for you. You've noted that role overload is listed as a job-related risk. However, it's also an organisational and team-related issue, and pushing it to an individual level is stigmatising. You're the weak link. If one's workforce is overloaded, what do you suggest to be done to gain some momentum to do things differently at a team level? Well, that's a tricky one, isn't it?
That's a big question, but it's a great question, highlighting, I guess, the interplay of the different levels within the organisation. And I think that's where the manager comes in and if they're well skilled in being able to identify this risk and manage it alongside the individual. And this can be through just regular check-ins with the individual, seeing how their work is going. I think that's a question I regularly ask my staff. It's an easy conversation starter, and then together they can work together to manage that risk factor.
Great, thank you. So this is from someone who works in health, and understandably managers and staff are sensitive about the R word, resilience, as they're incredibly resilient, which has been evident during the pandemic. Is there other language we can use to frame that if that word is getting a bit old or has too many other meanings associated with it now?
Yeah, I think that's a great point, and it sort of ties in with the part of the question that came through before, in the fallback, kind of the pressure coming back onto the individual, and that's what we're trying to move away from, so that I guess we have managers and organisations and champions within the organisation really promoting these strategies and supporting individuals. I don't have a separate word to replace resilience, but I think it's a great point.
Yeah, and I think it's good just to have an open conversation about that word, and I like it being referred to as the R word. Christine, would you mind repeating the 4 focus areas that your working group focused on? Oh, someone has asked for that.
Yeah, definitely. So the first one is promote positive health and wellbeing. The second one, improve understanding of mental health. Thirdly, support employees living with mental health conditions. And the fourth one is around addressing risks related to poor health and wellbeing. So it's that preventative stuff, that fourth one.
Yeah, great. Look, there's lots of questions here. It's really hard to choose which one. We've probably only got one for one more. Can you share some examples of effective risk management controls you have seen implemented? Who wants to have a go at that one?
Yeah, I can jump in. I think I'll use a common example of a workplace that was affected quite badly by the perception of bullying and harassment over a long period of time. And we became involved in the workplace to try and provide some support, and obviously from a compliance perspective. And what the workplace was doing was rolling out their annual bullying and harassment training on a regular basis, which obviously hadn't improved the situation year after year. So some of the control measures, when we sat down and talked to them about what a psychosocial risk assessment looks like, and bringing it back to the jobs demands, job resources model, we helped them to identify that there are a number of issues around the lack of role clarity, group task conflict, and unreasonable work demands, tight timeframes, deadlines. So it was as simple as some people hadn't had a job description or a performance review for up to 8 years. It was as simple as they don't even know who they're supposed to be reporting to. They're receiving direction from multiple managers. There's a lot of change going on in the background. So sometimes even just those sorts of simple solutions are a great first step.
Yeah, great. That's an excellent example, isn't it? Yeah, great. Okay, I'm just going to share the slides again. Hasn't that time gone so quickly? And I'm sorry that we didn't get to answer everybody's questions. Thank you for your really thoughtful questions and comments to us and the panel. And thank you so much to the panel for answering all of these and giving us a bit more insight into this issue. If this issue has raised your interest and you'd like to know more and to develop some skills in better managing the psychosocial risk factors in your workplace, please let the Black Dog Institute help you. We've got a whole research team that has been working on this, and we know what works. Our training programs are delivered by experts. They're tailored to suit your workplace needs, and they provide practical skills to manage mental health and support others at work. And as we've highlighted today, people leaders play such a pivotal role in managing psychosocial risk factors through the behaviours they model, their ability to observe and act when they notice a team member's having a difficult time. So we would recommend our Managing for Team Wellbeing program to provide knowledge and skills to impact on positive mental health and wellbeing at a team level. So please feel free to reach out to the Black Dog Institute workplace team and chat about how we can help you. Please also complete the survey at the end of this webinar to provide your feedback on the format, the content, and let us know what you'd like to hear more about so we can pull together another panel to answer any of your questions in the areas that you most want to receive assistance around. You'll receive an email this week with a link to the recording and more information about how we can help support you and your team. If your question hasn't been answered, please email and get in touch. So 1 minute over, we've done pretty well for time. I'd just again like to thank the panel and also to thank everybody behind the scenes at the Black Dog who organises these, and also thank you for spending your lunchtime with us. And hopefully we will see you again soon. Thank you. Bye-bye.